We're going up and down, over and over, over and over. It's the same old thing. Up and down, over and under.
All right. Well, Jamie, welcome to the show. Excited to talk to you today.
Excited to be here.
Yeah, we caught up a little bit before this, and we had the opportunity to talk before. Like I told you, your company Advitam kind of sits at the center right now of a very interesting space. So people who listen to the show know I've grown increasingly interested in like anti-aging, longevity, improving your health span, and something that continues to pop up is peptides and hormone replacement, and as I kind of become a bit more familiar with just like hearing the term, admittedly, like I really don't know much about it. And so when I found out about what your company is doing, I was like, oh man, they're sitting right square in the middle of this. But then on top of that, when I found out a little bit more about your personal background, you also kind of seamlessly straddle the world of like athletic training and elite sport. So I was like, oh God, this will be perfect. So maybe for those who don't know anything about Advitam and have not yet been introduced to you, could you maybe open up just by telling us a little bit about yourself and maybe even like how you progressed into co-founding this company?
Sure. And thank you for having us on. Thank you for having me on. Advitam, which in Latin is really probably pronounced Advitam, means for life or to life. And we found that was an appropriate name for the types of services that we do over here, which have a scope of hormone replacement through peptides, longevity, anti-aging, and we'll get there. And I think it's a hot topic. It's a little bit ambiguous and unclear to people. What does it mean? Can you really reverse age or slow aging, the aging process? So we'll get into it. But as far as me, so I'm a physician assistant now. Prior to that, I was an athletic trainer, and I worked with various sports teams, doing that for about 15 years. I had a short stint with the New York Jets way back in 1997. I was more of an intern staff member at that point. That's really what I wanted to do, is work with professional athletes and medicine in some capacity. For those people who don't know, an athletic trainer is different than a personal trainer in that you're kind of somewhere between a physical therapist and a medic, and but specifically honed for athletes. And so taking care of their injuries, making sure they can, kind of like a mechanic, making sure they're ready to compete, and getting ready for the next competition. Shortly after that, I ended up hooking up with professional tennis and the United States Tennis Association. So I would travel the professional circuit in the United States, and I would be there on site for the tennis professionals to get them ready for matches, take care of their injuries before, during, or after matches. And I did that for a while. And then a few of the American, I became, developed relationships with a lot of these young American players. And one of them decided, as he got better and made it up to the higher rankings and was touring the ATP circuit, he asked me to come and travel with him and basically work for him. So from that aspect, a player usually travels with a coach who takes care of their tennis training and coaching. And some of them can bring a trainer or a physical therapist with them to basically look after their body. And so I did that for a while, and then kind of moved around between different players on the ATP Tour and WTA. And sports medicine was my world, so I loved it. But the travel became exhausting, and really,
I can't even imagine.
It was tough, especially on a personal relationship. So I was on the road 9 months of the year, maybe not consecutive, but it would be 6 weeks on the road, 1 week home, 4 weeks out, 1 week back. So So I was trying to also grow up a little bit and have a relationship, and that wasn't the best option anymore. So I gave that up and, applied and went to PA school, became a physician assistant, and then went into orthopedic surgery after that, because that was familiar to me, and I still loved, sports medicine and wanted to, work in some capacity with athletes and orthopedic related issues. So I did that for a while, and I'm just kind of leading up to how I got to anti-aging, which was
this is great. I feel like we're just gonna, but sadly, we're gonna breeze over what I imagine was probably like decades of awesome experiences. Like I'm sure there's like no shortages of stories that we could talk about, like being on the tour, traveling internationally, being in these massive matches.
Yeah, sure. That was, it was fun, it was fun, but it was also work, right? I probably went to, I don't know, 20 countries and saw so much, but was so dialed in that you're in a country for a week and then you're gone. So, but there were some fun times, but it was work. So, it's, living out of the hotel was fun for a minute, and then you kind of feel like you're lost. Like, where do I belong? Where am I supposed to be?
Yeah.
But in orthopedics, we would do some regenerative procedures, PRP injections, stem cell injections. That led me to always doing extra training and courses and whatnot. There was a functional medicine doctor here in New York City who's a friend, and he didn't like doing procedures like injections and stuff like that. He was more of a primary care type of physician. So he had asked me to come down and help him when he had patients that could use some knee injections or joint injections. So I started, freelancing, helping him with that stuff, and then being around what he was doing in functional medicine really interested me. Really paying attention to metabolism. So, just to clarify for some people, functional or
this would be great.
Yeah, functional and alternative medicine doesn't fall in the traditional types of practices, not cardiology, not primary care, not urology, etc. So these functional medicine doctors are pretty much like primary care doctors, but they kind of specialize in looking a little bit deeper into what's wrong with your body. Maybe I can figure out why you have high cholesterol, why you have rheumatic diseases and whatnot. So they go further into looking at labs and how can we, on a more natural and in a more natural way, maybe fix some things so you don't have all these diseases. Maybe we can fix your
root cause
resistance.
Yeah. And I that's something that I've grown increasingly interested in, because, oftentimes the quick fix, quote unquote, is really, it feels like a masking of the symptom. And it's like, man, but do I still have that underlying issue that needs to be addressed? And have we just kind of created like a new dependency now that I have on this new crutch? Like what if I just had a great conversation the other day? He's like, look, what happens when that crutch gets taken away? Like, what happens when you no longer get access to that medication? This is not like a war on medication by any means, but it's just got me thinking on a deeper level. It's like, man, like how do we keep getting closer to the root issue?
Absolutely. And I'm not anti, there's a place for everything. And I'm traditionally trained in medicine as all PAs or physicians are. So there is a time where you do give steroids, corticosteroids for inflammation. There's a time where you do give antibiotics or blood pressure medications. But there's, also a need or a want and a desire to, figure out, maybe you can figure out why someone has high blood pressure, and we can do all the things we can do to improve it and maybe take them off that medication or lower the dose of medication. So I'm not anti-traditional medicine whatsoever. This just kind of really interests me. And so being around that functional medicine doctor for a while, I became more interested and then started, joining the organizations that train and clinicians for either hormone optimization or hormone replacement and longevity and metabolic types of treatments. And, that's really what I found it fascinating, and just kept going. And I ended up over taking a chance and leaving orthopedics. And my first run after that was really a men's hormone practice. And it was cool because there was a need. Now I was seeing patients that were middle-aged men who weren't necessarily ill or sick, but just didn't feel great anymore, didn't feel as manly as they used to, low energy, sex drive. Some of them were, just your average sedentary person. Others were, hey, I've always been an active person, and I just, I just don't have the energy to do the things I want to do. And this was an area of medicine where, we're kind of helping people get back to, feeling good, feeling motivated, confident, and healthy. So that was my first part in this. And then I, started to feel like, well, there's more to this than just men and hormones. So I kept going and did more training and brought women into what I do. And, I had met a great friend and a physician along the way, Dr. David Schaefer. He's a double board certified plastic surgeon here in the city. And we knew each other for a long time, but it was at the right time that we had a conversation, and he thought it would be a great thing to add this to his practice in some capacity. So he's fixing people through plastic surgery and cosmetics. And, we thought, wouldn't it be great to be able to address the inside of the body out, the metabolism, their cells? And so Advitam was created, and, our location is here in New York City. However, we've just, we've had a really nice, overwhelming response to the types of services that we're providing. And so we've just started, or we're about to license to a few other practices, basically the Advitam brand, so that they can basically do what we're doing and bring it into their practice, and offer these types of services to their patients as well.
Yeah. And I think, maybe that's indicative too of like, we're kind of, it feels like all of a sudden this like anti-aging longevity space, it's just like exploding. It's like caught like popular consciousness. Like I just, and it's a great book. I recommend it. Tony Robbins just wrote that book, Life Force.
Yes.
David Sinclair has put out so much incredible work. Like I'm always fascinated reading about all the incredible things that he's doing. But it just feels like, all of a sudden it's like there's a lot of people who are really interested in this, and it's an exciting time because all of a sudden, like all this science and technology and capability is kind of like becoming available. I had a really interesting guest on, man, I don't know, maybe it was 6 months ago, but he wrote this book, Ageless. And the book is focused on like, hey, look, let's have an honest conversation about where is everything today? What do we know? What research is being done? What studies? What are the different like approaches and methods being tried? And a lot of it was like, hey, look, we need to wait and see. But like, that's no longer like wait 50 years. It's like, we might get really concrete answers to a lot of these questions, like in our lifetime, maybe in the next 5 years. So it's like, we're at this really interesting point, like inflection point. It kind of feels like where things are just like exploding. There's a ton of interest. The technology's catching up. But that's why I want to talk to you, like so I'm 35, male, obviously, as an example. And I'm like, again, that reading that book, Life Force, I think I just heard a quote. It was like, hey, biologically, our purpose was served for men by 35. Like evolutionarily, like there was really no need for us to go beyond 35 because we should have already procreated. Like our body, our entire like biological focus was on like reproduction. And it kind of got me thinking. I was like, holy shit, I'm 35. you know? And I'm like, all right, well, what's going on in my body? Like I'm becoming painfully aware that I'm not invincible. And so, like the conversation naturally goes toward like, oh, changes in your hormones. And so could we maybe talk about that a little bit? Like hormone therapy, like broadly, just kind of like, what is that? How does it work? And, selfishly from the male perspective, like, how are you often like working with your patients?
Yeah. So, there's different types of hormones. Testosterone in a man is your primary sex hormone, and it's the primary hormone that makes us masculine. And
Mm,
but we do have estrogen or different types of estrogen. We do have progesterone. There's also growth hormone to think about. So hormone therapy is a very broad. There's thyroid hormones. It's a
mm,
broad topic, but most men
okay.
think of hormone therapy as testosterone replacement, and that's a big part of it. I think the way we do things is we have a patient come down for an evaluation. That consists
Hmm.
of and it's a consultation that's it's not that quick. It's an hour. To do it right, ask a lot of questions, find out what someone is experiencing, what are their symptoms, or what's just not great anymore. So we take a good history, we do blood work, and further look at hormones and certain vitamins and certain biomarkers. Um, and we use a body composition analyzer to look at body fat and muscle mass. And, we do all these things to kind of figure out what can we do with this person, within healthy guidelines, safe guidelines to optimize them. Or there are people that or men, let's say, that have very low testosterone that it's quite obvious that they need testosterone therapy. You do a blood test,
Mm.
and their level is 100 or 120, and there's a diagnosis for that, and different.
And a healthy, what's a healthy range would be like in like what?
Well, that's it's up for debate, but
Okay.
I'll tell you that when you do traditional blood work, you'll see, depending on what lab your blood work is done through. In other words, it could be LabCorp, it could be Quest, it could be some other lab. There's always on the side a reference range, and I
Mm.
caution people, because people, in certain types of lab values, that reference range is very very important in terms of, let's say, your red blood cell count. You have too many red blood cells, that could be a problem. You have too few red blood cells, that could be a problem. With hormones or testosterone in a male, that reference range, depending on the lab, may say 200 to 900, or 150 to 1200. So it's this huge, wide range.
Massive. Yeah.
You have to ask yourself, why is that? So that means I could be at 250, and so can an 80-year-old male, and it still fell between the normal range. So, some doctor may say, you're low, but you're in the normal range. And and so we've kind of learned, or the people who are really subspecialized in this stuff, we feel, or I feel, I should say, I can't speak for everyone, that an optimal range for men's testosterone level is in the 700 to 800 range. You may say, some will say,
Hmm.
hey, I like 900, or I think 750, but that's pretty much where is an optimal level, where you also can achieve health benefits, improvement of a lot of functions of your body. Where the off-label bodybuilders are going to think that those levels are way too low.
Hmm.
So this is also talking about a specific test of a total serum testosterone, and then we have to address how much of that number is available to you to use for you to use. So you might have a 500 level, but you have something else called sex hormone binding globulin, and that level may be really high, which really takes that 500 and tells us how much of that is available. If we've heard the free testosterone or bioavailable testosterone, that's really going to tell you how much is available for your body to use. So we factor all those things in and then determine is somebody a good candidate for testosterone therapy, so
Is it, sorry, I didn't mean to interrupt you. It kind of makes me think, God, like I almost wish, and I mean, now that, I could start doing it today, I suppose. And a young person has access to this too. I'm like, man, I wish I would have had like a baseline. I wish I would have known what my levels were like 20, 25, 30, because I have to imagine, like you said, it already sounds like it's so individualized, like most things. But just out of interest, I would have loved to have known like what that looked like, how it changed over time. And so I guess, and I'm sure you were going there in some respect. It's like, how do you start to narrow in on like what's optimal for someone?
I guess it's from, you experience from doing it tells us a lot. I've been fortunate to have a lot of male patients over the last 6 or 7 years. And you kind of learn, but really it's a balance. So it's bringing the testosterone up to what we feel is an optimal level, right? Let's say 700. We'll just pick that number, but also watching their estrogen as well. So things need to be balanced. Otherwise, even if I bring you up to 1,000 with testosterone, you may not feel great because I didn't address your estrogen and that went too high. There needs to be a symmetry, a balance, and monitoring, proper monitoring. So, with that being said, I caution, there's a lot of people doing this now. And some groups are doing it excellent. They're monitoring, they know all the right questions to ask. They know all the right things to do. But, I would just caution people to just ordering stuff online and not having a good qualified clinician be at the helm managing their program. Obviously, you can buy almost anything online and you can get it a lot cheaper than if you came to see me, but there are risks with that. And so I just think it's, using the right person to help you figure out where you should be. And higher isn't always better. I've some people feel great. If I didn't tell people what their number was at, in other words, if I tell someone, well, listen, you're at 500, they may say, oh man, can we increase that? I got to increase that. I heard 700 is the best. But if I told them the same day, hey, everything's perfect, you're at 700, they're like, yeah, I feel pretty good. So
feel great, right?
I don't know. I've always been trained, treat the patient, not the labs. See how somebody's feeling, see how they're feeling, and that's one of the keys, I think, to working with people.
Yeah. Oh no, I love that. And I think, I imagine your patients appreciate that as well.
Yeah.
Well, and look, like I know you have a very busy day. And so I want to make sure we spend time getting onto some of the really interesting things that you're doing with regards to like anti-aging, longevity, peptides. Where do we even begin? Maybe could we just start talking about, does it make sense to talk about peptides? Because I'm seeing this pop up everywhere, and I would love a better understanding of what the hell it even is, as I'm sure a lot of people would.
Peptides are a really hot topic right now. We first started seeing them come out in the mainstream, right? It was, hey, collagen peptides. You can use a collagen peptide cream and peptides in your shakes. Collagen's a protein, and I'll take a step back. Peptides are chains of amino acids, and by definition, if you have 2 amino acids to 50 amino acids, those are your peptides. And then if you have an amino acid chain that's between, let's say, 51 and 100, that's a polypeptide. And then after 100 chain in a chain, it would become a protein. So And, now there's all this discussion. Somebody's changing the definition of peptides, maybe down to I don't want to get off, but let's just assume they're chains of amino acids up to a certain length. And in the body, what they do, they're signaling molecules. And so they work on a cellular level. And this is kind of, I hope I'm trying to put it all together to sum.
This is great.
As we age, your cells are performing functions all day long, right? And maybe I could put it this way: every 24 hours, each cell is going through a cycle, doing checks and balances, and they clean themselves, and that's called autophagy. And so if you have a cell that, all right, I'm doing my checks and balances, and wait, we have a problem here. The cell makes a decision. Okay, I can fix that, and I can clean that and repair myself, and that's what it's supposed to do. Or the cell identifies that I'm messed up, I'm unsalvageable, I'm going to self-destruct. As you age, it becomes more and more difficult for the cells to make those decisions. So you may have a cell that gets stuck. It didn't self-destruct, and it didn't clean itself, and it's in this what we call senescent state, so cellular senescence. So, and the more you age and the more you're exposed to the environment and toxins and everything, this is what happens. And so I think the beauty of peptides is that there are different various peptides that are identified in the body, thousands of them, and they can improve cell functions and really help. I don't want to say eliminate cellular senescence. I could be wrong. Maybe saying eliminate is okay, but certainly improve your cellular efficiency. So that's the way I look at it. Is there are some peptides that we've identified that can work on healing and repair, some that might be more specific to the gut, or some that are more specific to the brain, some that can get your body to make and release growth hormone again, knowing that when you start hitting your 30s, your growth hormone levels start to decrease. And I don't want to go too far off a tangent. We would give, sometimes give adults growth hormone for longevity benefits. But what if instead of giving you human growth hormone, maybe we can get you to start making growth hormone again? And that's where the beauty of peptides come in, because we can maybe, tweak cell functions. I look at it, when a person's talking to me and we're doing an evaluation, I'm kind of listening to them, and then I'm just kind of visualizing, all right, I'm going to tweak these cell functions on this person. We can fix this, kind of like bringing a car in for a tune-up. So I hope it wasn't too far off on a tangent, but really improve.
I was going to say, this is like, honestly, might be one of the most easy to understand explanations I've ever heard of this process. So, at least for me, I don't know if people listening at home are lost, but I'm like, damn, that helped a lot, actually. And I've like someone who is really interested in this, and I've tried, I'm like, it can become very, it's a lot. It can be confusing to a person who's a layman, but like that makes complete sense to me.
Yeah. I feel like I have a tendency to go off and get a little too nerdy at some point. So just let me know. I'll bring it back. But
appreciate it. No, you're good.
I think that's the way to sum it up. So if you can fix how, the efficiency of how your cells work, you are essentially assisting your aging process or improving it. I'm always hesitant to say slowing it down or reversing it. Do I have any
curing
to say that? There are scientists all over the world studying this stuff, and just the other thing that really has been positive with peptides is the safety profile, and I think that's why they're also.
Yeah, I wanted to ask you about that.
Yeah, I think that's why they're gaining so much traction. Is that it doesn't mean you don't have to be careful, and it doesn't mean that you can't, have an adverse reaction. But if you're putting these chains of amino acids that you're injecting, many of the peptides are injected subcutaneous.
Okay.
So small needles into the belly fat or the tush fat. Some of them are oral, or some of them could be in a nasal spray. They're essentially bioidentical. Your body should recognize them. When you inject that peptide that's going to signal your pituitary gland to make growth hormone, it's a chain of amino acids. That's how they identified. They identified the peptides in the body, the chains of amino acids that were doing specific functions, and then went to see, can we reproduce this? Can we synthesize it? So they are essentially bioidentical in some capacity. So it's not it's not a foreign compound that your body shouldn't recognize.
Well, and something you said too, to bring it back to an earlier point, this to me sounds like cellular getting to the root cause, right? Like we talked a little bit about like masking symptoms with like, some other means, but it's like, hey, can we get closer to like the underlying issue? And like, when you gave that example of the human growth hormone, it's like, yes, like the reality is like you might be low, and yes, there's a treatment where we could, it sounds like, just inject you with human growth hormone. But I think, when I hear this explained, and maybe for a lot of people, it's like, I would way rather get to that underlying issue. Like, how do I get back to naturally producing the right amount of growth hormone? And I think that's what's kind of so exciting about the space. And when I was searching and learning about it, it's not, I think there are some people, to your point, who say like, oh no, we're going to cure aging. Like aging is a disease. And, but it's so cool. It's like, there's natural processes that happen in the body. And as you get older, for a variety of reasons, they start to break down or not work as efficiently. But I think for someone who's a bit of a fixer, it's exciting to hear like, no, there's like some course of action that we can take to like get this machine humming again.
Yeah, absolutely. And growth hormone always comes up, and it's probably one of the most popular peptides. There's a few of them that can assist in growth hormone release. The beauty about them, to me anyway, is that it's more difficult to overshoot. So if I gave you growth hormone, if I gave you human hormone, I really have to be careful on how much I'm giving you, and if it's too much, because other problems can happen. You can cause, let's say, increases in aldosterone or prolactin, or things that can then lead to problems with kidneys or organ problems. So with peptides, your body, your cells are smart, right? So they get this, you inject this peptide, it's the chain of amino acids, it should recognize it. It signals you to start producing growth hormone, and then it's going to stop. So it might be 7 to 12 minutes or 12 to 20 minutes, depending on which peptide you're using, where you're going to start pulsing some growth hormone. And then your cells are smart. They have basically a shut off where, hey, that's good. I've done my job. That's enough for now, just like it did or does naturally. So taking more of it necessarily doesn't mean you're going to make more growth hormone. So that's a great safety benefit to have with So sure, it's not going to be the top choice for a bodybuilder who needs to put on 35 pounds of muscle or 50 pounds of muscle, because you can't push the limits. But that's not the intention really of what I do or the population I work with, though I have plenty of guys that look fantastic and you would think they're taking all sorts of stuff, and they're not. They're just they're consistent, and they're doing things consistently and taking well-monitored programs.
No, it's cool, right? Because again, now I'm really going to simplify it. But to me, it's like, your body kind of has, and your cells have like this governor, right? And it's going to cap you out at like what should be healthy for your body, unless you have some other, sort of condition that probably needs to be addressed. Versus, to your point, because that was one of my immediate questions with all of this stuff. It's like, oh, well, how safe is it? And the more I kind of hear like how it works, it almost sounds like it is enabling your body to do maybe not what it was like supposed to do per se, but like what it was capable of doing and maybe had previously done in the past. Like, is that a good way to think about it?
Sure. I pretty much say the same thing to all my patients. I said, just think of it as we're getting your body or getting your cells to do their job better, and it's funny, you tweak these little functions, consistently enough, in the right way, and people start to feel different. They start to feel better, and other people really comment to them. So you don't get a high, right? So, and it doesn't work like a pain reliever where you take a painkiller and immediately you have an effect. All right, this worked. It fixed my pain. I won't say that. I mean, look, you will notice increases in energy and depending on what we're doing, sex drive and performance. But I find that it's consistency that really, gives you these benefits. And so I do. Well, I guess the reason I bring that up is, don't try something for 3 weeks and just give up on it and say, well, I don't know. Give it a chance and work, and go on a real program and you can really see what these things can do.
And and I guess that I was going to ask you that. What does consistency look like? Like how long would a peptide treatment be effective for? How frequently does someone need to come in? Does that change over time? Like, does your body begin to like, for lack of a better way of describing this, like wake up and it's like, oh no, like, hey, like this is how we're supposed to operate again? Like, how does all that kind of work?
That's a good question. There are some peptides that we use for a shorter duration where we'll say, after about 4 or 6 weeks of this, we take a break from that. I find that anything you do, if these are signaling molecules and they're working with receptors on cells, and I feel if you overstimulate receptors continuously, sometimes things don't work as well as they used to. And some of this is my opinion. Some of this is also how I've been trained by someone in the community, Dr. William Seeds, who's brilliant, trains a lot of us on peptides, but he really trains us in cell medicine. It's really what it's about. And piggybacking off of what you said, because when you said that, it's really what it is. Peptides are a part of cellular medicine, and that's what it's really about. But so how long do you stay on them, and when do you see results? It's variable. In other words, I think you get the best long-term benefits with growth hormone peptides when you're consistent with them. However, I take breaks in between with my patients, like, hey, we've been on this for 3 months. Let's take 4 weeks off and then go back on it. And then again, 4 weeks off later on. Just so I feel like if you allow receptors to not become overstimulated, you keep getting a good response. There are some immunomodulatory peptides that work on the immune system. And, with those, I'll use some of them for, let's say, 6 weeks at a time. And then I back off for a little while. Let the body do its thing. Let them, and then later on, a few months later, maybe we do that peptide again. So
Are people coming in weekly? Okay. Is it like weekly, month? Like how often, how frequently do they need to come in for like these sorts of treatments?
Yeah, I mean, it depends on who you see for this or where you go for it.
Oh, okay.
In our practice, we put people on a plan that we draw out about 6 months in advance. 6 months detailed. Hey, this is how your plan's going to be. I like to see. I like to see them, once every 2 months to switch peptides or just follow up and make sure they're doing okay. If there's a problem, what's working, what's not working. So, that doesn't mean I don't have some people that I see maybe 4 months, but the way we do it.
So can they administer this themselves? Because I guess I was thinking, I'm like, boy, this sounds awesome. I'm like, but I don't know if I could get to the office every week to go, okay. So yeah, maybe before I start talking about what I think, how it might work. Like how does that sort of administration process work? And again, I imagine it probably depends on the peptide and treatment. But.
Yeah, it does. But I would say a large portion of them are subcutaneous injections. So you're talking about, I wish I had a needle here I can show, really, really small insulin size needle, 5/16 of a length. That might mean nothing to anyone. It's really small.
No,
and you can, put them in the belly fat or the fat here. So some of them are injected daily. Some of them are injected, let's say, 5 nights a week and 2 nights off. You hear that a lot with the growth hormone peptides. Then if you're dealing with someone in performance enhancement, they may be doing it more regimented a few times a day. But there are some that would be injected once a week. But the bottom line is they're self-administered. I mean, we start a plan off. We have a patient here in the office. We run through it. We go over it with them, or we do a virtual FaceTime or something where we instruct them, and they're doing it on their own at home. So no need to come in the office for like the procedure per se. I mean, sometimes maybe if you're doing an drip or something, but no, it's administered at home. So.
Oh, wow. Could we, and I know we've maybe got just like 5 more minutes here, but just for people who are interested, could you just kind of give maybe a broad lay of the land of like, what is the spectrum of either like conditions or issues that like peptides could potentially like help alleviate or be a solution for?
Oh man, they're limitless. And I can tell you that the oncology world, the cancer world is very interested in them. All areas of medicine are really becoming interested in them because they're targeted. They're going to go to a certain part of the body. And I'm not an expert in all these areas or all these, what they're working on. But just to sum it up, if they can use a peptide alongside a chemotherapeutic agent, you might be able to target that chemotherapeutic to a certain area rather than kill off all the cells of the body. You can really target it. So again, I'm not an expert.
Oh, wow. Yeah. But, my head didn't even go there, but that's really exciting.
Yeah, so even mainstream medicine is interested in this stuff, but right now you're seeing a lot of it in clinical and practical use in these anti-aging world, but there are some for healing and repair. So orthopedics is interested in some of these peptides. So really all aspects of medicine really are getting involved.
Can benefit.
Yeah.
Wow. Well, and now I'm sitting here thinking, I'm like, I steered the conversation towards peptides immediately, and it's not fair with like 3 minutes left, and maybe we can have another conversation at a future date. Like, what else are you kind of excited about right now in terms of the realm of anti-aging longevity? Either something you're doing within your practice, something you're keeping an eye on.
I mean, I'm excited. I mean, this is the core of what we do. Sure, we do IV drip infusions, and vitamin injections and those things. But I really think what we call our program is metabolic optimization, a metabolic optimization program, which largely involves various peptides. I'm excited because it's working. People are getting results. When we have our patients, male or female, but I'll even steer it to female. And we, let's say, optimize their hormones and then start adding some peptides that have been shown to help with weight loss. We're taking these women and men, who are between 40 and 65 years old, and they're starting to see results again for the efforts they're putting in. Obviously, people exercise is still nothing's going to trump exercise for your health. It's going to stimulate all the cells in your body. But at least now, when you're working out, exercising, and eating well, you start to see results again by fixing these cell functions. So it's results driven. People are happy and they're coming back because they're getting results, and that's important.
Yeah.
A happy patient. I can't bear to charge people for a service if they're not getting results. And if they're not happy.
Yeah.
So.
Oh man. Well, hey, honestly, this was I hope for most people who are listening who weren't aware, like for me, this has been a fascinating introduction. I would say, if anything, I'm interested to learn more. But for people who, we've talked a little bit about Advitam, people who want to either know more about your company or about yourself, like where can I point them?
Appreciate it. The website is www.myadvitam.com. We're on Fifth Avenue in Manhattan. We're part of the Schaefer Clinic here. But yeah, if they just look us up and reach out with a phone call, we'd be happy to talk to them, see them, advise them. Yeah.
Awesome. Well, hey, this has been a great conversation, and we'll have to have you back on in the future. And I mean that sincerely. I know I told you before the show, but I mean, this was a great conversation. I'm sure there's a million directions we could have gone, but again, I feel like I learned a lot during this.
I love it, man. Thank you so much for having me. I really appreciate it. Yeah.
Yeah, you got it. You got it.